Meanwhile, back in California, InTouch's amazing telepresence robot is ready to leave the comfort of the workshop and testing grounds and give us a demonstration in the real world. Its mission? To bridge the distances between doctors in bigger cities and patients in rural hospitals. Rural hospitals like this one in Sebastopol, California.
The idea was to go to rural America and take the technology of the big hospital, namely the availability of consultants, timely, with expertise, to really help the rural ICU. And then I heard from a nurse about a robot that was available, and we decided to give it a trial.
Meet Dr. Jim Good, or as some people call him now, RoboDoc. His new InTouch robot allows him to travel to many different hospitals, all from the comfort of his desk. All a hospital needs is a robot he can beam himself into.
The key thing is to be able to get on the internet. And then once I turn the control station on, I can select the hospital, go onto the robot face within 30 seconds. Generally, I'll speak to a nurse. They'd call me to go there to see a patient.
But what do patients think of this robot avatar? This is Jeffrey Taylor, currently awaiting treatment for complications from diabetes. He's about to meet Dr. Good via robot for the very first time.
Here I'm getting a visit from the doctor via robot. It's new to me, so it sounds really interesting. I don't exactly know how this is going to work, but I'm excited to find out.
Hello, Jeffrey.
Hi, Dr. Good.
I'm here to see if I can help you with the robot.
Sounds good.
I heard some of your story in terms of the problem with diabetes.
It forms almost a psychotherapy bond. You're talking to them. You don't interrupt them when they're talking.
Right now, I just heard that they now have an insulin pump that monitors your blood sugar.
It makes you a better listener. And you're able to really let them tell their story. So what you're doing, you can actually look things up while you're talking to them. You have another screen. I can look up different type of approaches, medications, reactions, and so forth. Couple things. Expect this afternoon Dr. Patan to visit you.
What is truly amazing in this case is that Dr. Good can actually bring in another specialist from a bigger city via teleconference, right to Jeffrey's bedside.
We have at our disposal a Dr. Peter Patan, who is a specialist in terms of transplants at UCSF, University of California, San Francisco. Jeff, would you be willing to meet him by robot later this afternoon?
Absolutely. I think that would be wonderful. Thank you, Dr. Good.
Okay, you're very welcome, Jeff. Take care.
All right.
Bye-bye.
When you go to the bedside, everything's fair game. You can look at the patient, posturing, facial expressions. You can have the nurse look for ankle swelling, checking for reflexes, putting the stethoscope where you'd want, shining light in the eyes, all of that. I can see the vital signs, see the temperature, the blood pressure, the pulse, the oxygen saturation.
The robot can even hook up to some basic hospital devices like stethoscopes and ultrasounds.
We've actually measured patient satisfaction by questionnaire. And we found that the patients have had more satisfaction with their care after the robotic service began than before.
In the future, technology like this may lead to us being examined, even treated by the world's leading medical experts, all while sitting in the comfort of our own home.
Now, if medicine can be delivered where time and space no longer becomes a constraint, where it's just kind of plugging into the healthcare network, then you can truly change and revolutionize healthcare delivery for the country and the world.
At OffSiteCare, the use of telemedicine is to improve quality of care in rural hospitals. By improving quality of care, we make the hospitals financially viable. If you want to learn more about OffSiteCare and our message, check our website, which is offsitecare.com. Thank you.